This is KMTV 3 News Now, live at 10.
Tonight at 10, area health officials say flu activity has been unusually low this season. How coronavirus precautions might have had something to do with this. Plus, the building that used to house an iconic restaurant in Millard started to come down today. More on the plans of the future of that site. But first, very cold out there this evening, and we're keeping an eye out for more snow headed our way. And Chris, I know we are looking at a couple of storms ahead, really.
Yeah, a series of 3. The first bout on Saturday, light snow, but enough to make an impact here, I think. So
good weekend to just stay in if you can.
yeah, and the time frame on that, late Saturday, is where it gets a little hairy. There will be some salvageable moments, but by and large, it's just going to get more active in the week ahead. It's quiet right now. You probably felt the big temperature difference today. Can you believe we were in the 50s on Monday, 40s on Thursday, and then back down to the 30s tonight? There's 3 chances for snow, 1 on Saturday, again on Sunday into Monday, and then a third Tuesday into Wednesday. So a lot to watch in the week ahead. An active pattern starting to set up. We'll focus most on Saturday's snow. The good news with all 3 of these, totals look to be on the lower end relative to what we could see, but still several inches, enough to cause some slick spots. Keeping an eye on our X system, just entering the panhandle, you could see some snow out towards Scottsbluff. Moving off to the east. Clear skies here for now. Clouds will gradually start to work their way in right around Broken Bow and Columbus so far, north of Grand Island and right along that I-80 corridor. Those are gradually sliding to the east. Temperatures have dropped with clear skies in place. We're already at 19 degrees in Omaha, 19 in Lincoln, 21 in Columbus. Starting off cold into tomorrow, likely back to about 20 degrees by 6 a.m. Mainly cloudy skies in place. The first signs of this system in the metro area around noon. Now we're looking at early afternoon into the evening hours, spread out about by 8 hours from start to finish, enough to cause some slick spots. I'll have a look at totals and timing in a little more detail coming up, Courtney.
To our coronavirus coverage now. Here are the numbers in Nebraska. The state reports 10 new deaths tonight. More than 1,800 people have died since the pandemic began, and there are over 186,000 confirmed cases. The state's 14-day test positivity rate is down to 6.33%. And in Douglas County, health officials reported 353 new cases today. That pushes the county's total to more than 59,500. There were 6 new deaths, raising the death toll to 576. And rates of another respiratory infection have been surprisingly low. 3 News Now reporter Alyssa Curtis looked into why the flu numbers are so infrequent compared to previous years.
While the number of COVID-19 cases do appear to be decreasing from our historic high back in November, cases of influenza have stayed low this season.
I have not diagnosed a case of flu yet this year, which is surprising.
According to data from the Douglas County Health Department, as of December 26, there have only been 8 reported cases of the flu this season. The 2019-2020 flu season saw close to 7,000 cases.
By a rough guesstimate, the number of patients we'd see, maybe a good 15-20% of them might have flu or flu associated or had flu previously and had a complication afterwards. But now, none.
COVID precautions, according to Dr. Hiley, have been a big reason and why we've seen numbers this low.
The main things we're doing, staying away from each other. If you're sick, you're staying home, wearing a mask, washing your hands, staying away, social distancing, very, very, very important.
The health department said a good number of people also received their flu shot this season. Doctors believe it was motivated by the pandemic.
I think people heard the message, get the flu vaccine so we don't have to worry about that too. And so I think they did act on it.
Doctors hope that we've learned more health safety during the pandemic to keep the flu numbers down in the future.
If we are more vigilant at particularly staying home when we're sick or wearing a mask when we're sick, which is something that I think may stick around, we won't see flu cause the same level of illness.
In Omaha, Alyssa Curtis, 3 News Now.
So this is really interesting. Doctors say influenza molecules are larger than those of COVID-19, and since wearing a mask prevents COVID-19 from spreading, it also prevents the spread of those bigger flu droplets. Governor Pete Ricketts says Nebraska's vaccine supply should remain steady in the foreseeable future. The governor says several of the state's public health districts have started vaccinating those in Group 1B. This includes people 65 and older and other adults who have health conditions. Right now, the state is receiving 94,000 vaccinations a month from the federal government. The governor added that he does not expect additional doses to come into the state at this time. Now to Iowa's coronavirus numbers. There are more than 4,400 deaths connected to the virus, and the state now has nearly 311,000 cases. The statewide test positivity rate is 11.2%. You can find more coronavirus information on our website, 3newsnow.com, and that's where you can watch the news conferences and find more resources. New tonight, at least 2 people were hurt following this crash on 72nd Street just north of I-80. You can see 2 vehicles with front-end damage. Officials say at least 2 were taken to the hospital in serious condition. The interstate exit ramp was closed down due to the crash, and that did cause a backup. And police are investigating what caused this crash on Dodge Street near UNO's North Campus. Omaha police say a car ran a red light, collided with an SUV, and caused other crashes. 1 passenger was taken to the hospital in critical condition. 2 others were seriously injured. Metro's Orbit bus service in the area also had to reroute due to that road closure. A bill in the legislature could get rid of Nebraska's motorcycle helmet law. Senator Ben Hansen of Blair is pushing LB 581, which he says is about personal freedom. If the bill passes, anyone who is 21 and older and has completed a motorcycle training course would be free to ride with no helmet.
There's all these kind of risks that we take in our life that are personal choice, right? And that's the liberty portion of it that I appreciate. I mean, the ability for somebody to make that decision on their own.
Hansen also says the bill would allow for more riders going to Sturgis to go through the state. The president and CEO of the Nebraska Safety Council argues helmets for motorcyclists are comparable to seatbelts for drivers. And the Millard Roadhouse started to come down today. Large equipment knocked large sections of the building that once housed a popular restaurant. It sat empty after the Millard Roadhouse closed 2 years ago. Now, Nebraska Medicine is building a new clinic at the site. Construction on the new facility should be finished in the fall. An Iowa facility for mental and physically challenged patients is under investigation for a variety of accusations. The 3 News Now investigative team takes a closer look at a Department of Justice report. An Iowa facility for mentally and physically challenged patients is the subject of a massive investigation. Accusations range from unethical experiments on subjects to poor care leading to an increase in deaths. 3 News Now investigator Jeff Van Sant delves into a highly critical report by the Department of Justice about the Glenwood Resource Center in Iowa and what comes next.
In December, the U.S. Justice Department released a report alleging the Glenwood Resource Center, run by the Iowa State Department of Human Services, violated the constitutional rights of its severely disabled patients.
Seth's medication was changed abruptly. He had been on seizure medications for 35 years.
Sybil Finken's 41-year-old son lives at the center. She says without her permission, staff took him off his medication he's been on for decades.
What had happened to Seth was he was like a drug addict. When they took him off all of his seizure meds, he was just wild. He couldn't be touched. He didn't want anybody touching him, and he was very combative. And Seth is, the doctors said they wanted to wake him up. And I said, why? You know, he's been comfortable all these years. Just leave him alone.
She says the trouble began under the leadership of Superintendent Jerry Ray. The DOJ says the now former superintendent, quote, embarked on an initiative to conduct experiments on residents in order to make Glenwood relevant.
I think he wanted it to be, he said, a research facility. I think he wanted to use our loved ones as guinea pigs.
The DOJ says under Ray's leadership, patients involved in one study were given increasing amounts of fluid, mostly through a feeding tube, leading to overhydration. The DOJ says it's dangerous for patients, leading to increasing cases of pneumonia. One person, prior to the 11-month-long study, had 2 pneumonias, and during it, he had 6. This DOJ chart shows pneumonia cases increasing after Ray became superintendent in 2017 until his firing in 2019.
A lot of these patients are profoundly disabled and they can't swallow. So by controlling how much water you can give them, you can control how much they suck into their lungs and pneumonia and death. Well, all of a sudden doctors were overruled and told to give them a lot of water.
Attorney Tom White represents 6 former employees, including doctors and administrators, who alerted the DOJ about issues at the facility. They filed a lawsuit claiming they faced wrongful termination and violated Iowa's whistleblower law.
There were different things that triggered the firing or the pressuring or the termination of our clients. Our clients are the people who tried to stop this and were fired, forced out.
The DOJ alleges improper care led to a sharp increase in deaths at Glenwood for a variety of reasons. This graph shows a sharp increase beginning in 2017. The report says, quote, Glenwood frequently leaves residents at serious risk of harm or death by ignoring changes in conditions outright or by adopting a clinically unjustified wait-and-see approach.
They wanted to, quote, make the institution relevant. So they started suggesting using people who are really so mentally compromised they can't consent legally to anything, using them as subjects in experiments that are really beyond awful.
In 2018, a resident named Benjamin Drisden suffered from bowel obstructions, begging to go to the hospital and wasn't taken immediately. The obstruction ruptured and killed him. The report says Glenwood's unresponsiveness to his initial complaint gave him virtually no chance of survival. The director of the Department of Human Resources was sacked along with Ray in 2019. The new director vows to fix the center's issues. The department says it's, quote, in the process of reviewing these findings. We have been in a collaborative role in this process from day one. Governor Kim Reynolds said in a statement, I am committed to bringing all the tools and state resources needed to address the challenges at the facility. There's no telling what the future might hold for the facility. It's one of the largest employers in the town of Glenwood. As for the lawsuit, the next court appearance is set for early February. For Sybil, she says new leadership is welcoming and change needs to come fast, but doesn't want to see the facility shut down.
It's not the facility that's bad. It was the leadership.
Jeff Van Sant, 3 News Now.
You can see this story and all of our investigative stories on our website, 3newsnow.com. And if you have a story idea, shoot us an email at investigate@3newsnow.com.
Coming up on 3 News Now, the snow machine turns back on a chance Saturday, Monday, Tuesday into Wednesday. I'll time it all out when you'll need the shovel coming up.
Now, your weather alert forecast.
Chris, I've got my thick jacket ready to go because I know I'm going to need it this weekend, but I am determined to make it outside a little bit.
We're going to get back to winter. Got away with it for a couple days. 50s and 40s just 2 days ago.
It practically tropical, right?
It was really nice. Now we're back to a more winter-like pattern. That means snow arriving for the weekend. Thankfully, not a lot of snow. I think enough to create some slick spots. It depends on where you are, too. We're going to have a spread of temperatures. That means a spread of precip types. Here's a live look outside. The bridge, nice and lit up, looking good. Bob Carey Pedestrian Bridge. Temperatures already dropping into the teens. We fell really fast under mainly clear skies and a relatively calm wind. Temperatures already got back into the teens. We should level off right around here. Winds out of the south sustaining us at least a little bit. Staying mild into the overnight hours and into tomorrow. It will start in the teens, but keep in mind January typically starts at about 13 to 14 degrees through the overnight hours. Radar quiet for now. We had the snow showers move through earlier today. Here's a 12-hour loop of satellite and radar. Maybe you saw a few snowflakes fly through parts of the area. It looked really menacing, but hit a wall of dry air, fell apart. A lot of the snow developed high up in the atmosphere but didn't quite make it to the ground, a phenomenon we call virga. Our next system just starting to move into the panhandle of Nebraska. Some light snow with that. It will get active over the next couple of days. We have a series of 3 systems making their way in, but none of them have a ton of moisture to work with. That means our numbers will be on the lighter side as we head into Saturday and then into parts of Monday and then again on Wednesday. Here's a look at Futurecast. Clouds develop early on Saturday. If you have plans for the weekend, before noon we stay dry. Some will stay dry throughout the day. Our next system rolls in by about midday. Watch that start to move into parts of the area, mainly targeting areas along the I-80 corridor and north. That's the red line here that runs